Chris, we're going to inject the left artery.
Okay.
Look at the LED that I previously put the stent in. And then we're going to go after a right PDA.
Right, PDA.
Yes.
It's a typical day in ORMC's cardiac catheterization laboratory.
How you doing, sir? We're going to look at the left artery that I fixed about a month ago, and then work on the new one today, okay?
Robert Meadows has a blocked artery in his heart, putting him at risk for a heart attack. In less than an hour, the artery will be repaired.
If you feel any sharp pain, you let me know.
A cardiologist will expand a wire tube, called a stent, in the artery to open the blockage and allow blood flow.
Chris, I'm going to need some more lidocaine, please.
Okay.
The doctor will be assisted by Chris Bulware, a cardiac technologist.
I've been doing it for about 10 years now. This is a very high-tech, promising job. It's changing every day.
Okay, we just found the vein.
You have vein.
Now we're placing a wire in the vein to guide the sheath that we put in there.
The wire enters a vein in the groin. Chris will help the doctors pass the wire all the way to Mr. Meadows' heart.
Vein is tagged.
Chris gives Lisa, the monitor tech, step-by-step updates so that she can document the procedure.
Long wire, short wire.
Let's try the short wire first.
JL4 going in.
Diagnostic, correct?
Yes.
Any discomfort, please tell me, okay?
This is our manifold, and our manifold is what we use to inject the dye into the patient's coronary arteries.
The dye makes it possible to see the artery in an X-ray.
Take a half a breath in. Hold your breath. Hold it. Beautiful. Chris, that's kind of a shepherd's crook, huh?
Yes, it is.
Should we use a mammary?
I think so.
I think a mammary will help us more, okay? You can see here that there is a blockage. See how this is normal artery here, normal here in diameter, and then you see a pinch inside that tube. There's plaque on either side.
You want to work on this visa?
Yeah, let me just do one more view here, a right PDA shot, REO shot. And what do you think, Chris? What do you, 2.5 or 3.0?
Look at 3.0. Let me look at the rest of it.
Chris, it's probably a 3.0 vessel, huh?
I think so.
Yeah, I think so. Bobby? I'm sorry, David. Bobby, I'm sorry, hon. Can you also bring in a 3.0, 15 and 18? This is a closed, slotted tube type of stent. It's like the spring inside of a pen, a little spring coil. That's what a stent looks like. And this is mounted on a balloon, and then we inflate the balloon. The stent is deployed. We deflate the balloon, pull the balloon out, the stent stays in place.
Advancing stent and wire together.
Okay, thank you.
And we'll test it here. Maybe just right, Chris.
B?
Huh?
I think so.
Okay, you can see the markers of the balloon catheter. The stent begins and ends right inside those markers. I want you to go to
Mr. Meadows, are you uncomfortable at all?
No.
21.
Okay, just be a little
21.
restless and
Yeah,
try
go to
to
eight-
move.
go to
We're almost
13.
done here, sir.
13. When we hook this device up to our balloon catheter, this is what determines how high we inflate the balloon inside the coronary artery to open up the blockages. 8,
And there's
10.
the balloon inflating.
I'm at 10.
Come down at 30 seconds.
It would be 10 atmospheres for 30 seconds.
Okay.
Deflating.
Take this out.
Coming out with this balloon.
Okay, ready?
I'm getting a lot of resistance.
Okay. Really?
Yeah.
Okay.
If you can feel it.
Let's see.
When we were trying to retract the balloon, we felt a lot of resistance, and when you feel resistance, your first instinct is to stop. Inform the doctor.
It's coming back.
Okay, try now.
Okay. He will make a decision whether we should decide to pull the entire system out, or we'll work on it until we can get the balloon out by itself. Balloon's out.
Okay, looks nice. Now you can see the final picture. There was an 80% blockage there before, and you can see that the arteries fully expanded there. Okay, nice job, Chris.
Thank you, sir.
Looks very nice.
Good job.
Came out nice. Okay, great.
System out.
A success like this is the best part of Chris's day.
It's just like winning a Super Bowl for us. I mean, we really enjoy doing what we're doing here. We're pretty much a big family, and that's the way it ought to be in the cath lab.
Chris's family of cardiovascular technologists will soon be expanding.
As the population ages, their coronary artery disease is going to continue to grow, and with that, there'll be a demand for cardiac catheterization and the other interventional procedures that we do. 6 French sheaths into the right femoral artery.
Cardiologist Arnold Einhorn is the medical director of a new program that will train cardiovascular invasive specialists. After a rigorous program of academic study at Valencia Community College, students will gain hands-on experience in the cath labs of major hospitals.
Early on, they observe. They don't touch anything, but as slowly you integrate them into the process, they'll be involved in panning and passing wires with the physician under the the guidance of another tech. So they eventually slowly work their way in.
According to Dr. Einhorn, this is among the most challenging careers in the hospital.
This is a very strict discipline, very difficult, very high stress area in the hospital, different than any place else in the hospital. And because we're dealing with the hearts, the arteries in the hearts are very small, and you're basically an air bubble away from killing somebody. So you really have to be extremely careful about what you do and meticulous.
At the end of a 2-year program, students graduate with an Associate of Science degree in cardiovascular technology.
It takes definite commitment. It's much harder than I think any other class that I've ever taken. It takes definite commitment because you are dealing with patients' lives.
I thought it was, one of the most important things you can be doing. You pretty much have someone's life in your hands, and you should take that serious. And it's a great feeling to leave out a procedure and knowing that you did everything you can to make sure that patient was taken care of.
Well, the future's here. I mean, if they want a very good paying job, which is very interesting and demanding, and really keep their focus, this is one of the jobs to go to.
If you'd like to become a cardiovascular technologist, contact Valencia Community College.